Welcome to a new episode of Norway Perspectives, brought to you by Norway Relocation Group, your trusted guide for settling into life in Norway with clarity, confidence, and peace of mind. In today's episode, we're going to explore a topic that's incredibly important for anyone planning to move to Norway, the healthcare system. Now, moving to a new country often brings a lot of uncertainty. You might be wondering, will I be covered by healthcare? What happens if I get sick? Do I need insurance? How do I find a doctor? The good news is, Norway has a well-structured, high-quality public healthcare system that's accessible to everyone who lives here legally. But it's also a system with its own rules, procedures, and expectations. So let's break it all down in a way that's easy to understand. 1. Norway's healthcare system is public and tax-funded. Norway operates a universal healthcare model, which means the state takes primary responsibility for making sure that all residents have access to necessary healthcare. The system is largely funded by taxes, specifically income taxes, and administered by public health authorities in each region. This means that once you are legally registered as a resident in Norway, you have access to healthcare services through the Norwegian national health system, without needing to pay for private insurance. And we're not just talking about emergency care. We're talking about regular doctor visits, checkups, maternity care, specialist services, and mental health support. The principle here is simple: equal access for everyone, regardless of income level or background. 2. Registering for healthcare. The Fastlege system. Now, let's talk about how you actually get into the system. Once you've moved to Norway and received your fødselsnummer, which is your Norwegian national ID number, you'll automatically be enrolled in the public healthcare system. With that number, you're assigned a Fastlege, or regular general practitioner. Think of the Fastlege as your gateway to the healthcare system. This is your personal doctor, the first person you go to for non-emergency medical needs. They manage your health, provide advice, treat everyday issues, and refer you to specialists if needed. To find out who your Fastlege is, or to change your doctor, you simply log in to the official health portal at Helsenorge, using your bank ID. You can change your Fastlege up to 2 times per calendar year. The doctor's office will usually have an online portal or a phone number where you can book appointments, ask questions, or request prescriptions. Most Fastlege offices are small clinics with a few nurses and administrative staff, and they usually speak excellent English. 3. Costs. Not free, but very affordable. So, let's address one of the most common questions. Is healthcare in Norway free? The answer is, not completely, but it's heavily subsidized and much more affordable than private care in many other countries. Here's how it works. Every time you visit your Fastlege, you'll pay a small fee, usually around 200 to 300 kroner, which is roughly 20 to 30 euros or dollars. The same applies to public specialists, X-rays, laboratory tests, and outpatient care. However, once your total yearly payments reach a national cap, called the egenandelstak, or cost-sharing ceiling, you receive a Frikort, or exemption card. This Frikort gives you free access to public healthcare services for the rest of that calendar year. In 2025, the cost-sharing cap is around 3,000 Norwegian kroner, or roughly 270 USD. This system ensures that no one faces financial hardship from regular healthcare needs. Prescriptions also fall under this co-payment system. You pay a reduced price for most medications, and once you hit the exemption limit, your prescriptions are covered too. SOS. 4. Emergency care. What to do in a crisis. What happens in an emergency? In life-threatening situations, you should immediately call 113. This is the emergency medical number in Norway, similar to 911 in the US or 112 in the EU. Ambulance service, hospital emergency rooms, and urgent care are all publicly provided, and you'll never be denied care in an emergency. There are also legevakt clinics across Norway. These are emergency outpatient clinics you can go to after hours or on weekends when your Fastlege is unavailable. You usually pay the same small fee for these visits, and the care is high quality. Legevakt is the go-to option if you need medical attention, but it's not life-threatening. 5. Seeing a specialist in Norway. One major difference from many other countries is that you cannot go directly to a specialist unless you're using private healthcare. If you need to see a dermatologist, a cardiologist, or a psychiatrist, you'll first visit your Fastlege, who will evaluate your needs and issue a referral. This referral is then used to book your specialist appointment. You can wait a few weeks or even months, depending on the type of care and your location. Specialist visits cost a bit more than a regular GP visit, but they are still subsidized. The same exemption system applies. Some people choose to use private clinics for faster access to specialists. These are available in most cities, but you pay out of pocket, and prices vary widely. 6. Pharmacies and medications. In Norway, pharmacies are called apotek, and they play a central role in the healthcare system. When your doctor prescribes you medication, they send it digitally to the national pharmacy system. You don't need a paper prescription. You just go to any pharmacy, show your ID, and they'll look up your prescription and fill it. Over-the-counter medications like paracetamol or ibuprofen are also sold at pharmacies, but not in supermarkets or gas stations, like in some countries. Many prescription drugs are partially subsidized, especially if they're for long-term conditions like asthma, diabetes, or high blood pressure. If you take regular medication, bring a list with you when moving to Norway, and ideally, a translated version, so doctors here can help you transition smoothly. 7. Dental and eye care. It's important to know that dental care is not included in the public healthcare system for adults. You'll need to pay out of pocket for cleanings, fillings, and other dental services. A standard checkup and cleaning might cost around 800 to 1,200 kroner. That said, children under 18 receive free dental care through the public system. There are also some exceptions for people with certain medical conditions. For example, people undergoing cancer treatment or those with autoimmune disorders might qualify for partial reimbursement. Eye exams and glasses are also private services. However, if you have serious eye conditions, you may be referred to an ophthalmologist through the public system. 8. Pregnancy and maternity care in Norway. If you're expecting a child in Norway, you're in good hands. The public maternity system is excellent. Pregnant women receive regular checkups, 2 ultrasounds, and access to midwives and doctors throughout their pregnancy. Most women give birth in a public hospital, and the cost of care is fully covered. After birth, the system offers support through home visits by nurses, postnatal care, and follow-up for both the mother and the baby. You'll also be eligible for parental leave, which can be up to 49 weeks with full pay or 59 weeks with partial pay, depending on your earnings and work history. Both mothers and fathers are entitled to leave, and Norway has one of the most generous and equal parental leave systems in the world. 9. Practical tips for newcomers. Let's finish with a few practical tips. As soon as you get your national ID number, register on Helsenorge. Know to view your doctor info and appointments. Always bring your ID or bank ID when visiting a doctor or picking up prescriptions. If you don't speak Norwegian yet, ask if your clinic offers English language appointments. Most do. Save your receipts and track your out-of-pocket costs. You'll automatically receive your exemption card when you hit the limit. Consider private insurance only if you want faster access to specialists or private clinics. If you have specific health conditions, bring medical records with you in English or Norwegian. So, there you have it. That's everything you need to know about healthcare in Norway as a newcomer. It's public, it's reliable, it's affordable, and once you're registered, you'll have access to a system that prioritizes equality, safety, and preventive care. Norway Perspectives is brought to you by Norway Relocation Group, supporting individuals, families, and professionals from around the world in making a successful transition to life in Norway. If this video helped you, consider subscribing to our channel for more practical guides, cultural insights, and relocation advice. And if you're planning to learn the language, we recommend our trusted partner, NLS Norwegian Language School. You can explore their courses, online and in person, at NLS Norwegian. No thanks for watching, and see you in the next episode of Norway Perspectives.